We are thrilled to introduce the International Indian Professionals Association, IIPA, a dynamic platform dedicated to connecting and empowering Indian professionals living overseas. At IIPA, our mission is to We believe that together, we are thrilled to introduce the International Indian Professionals Association, IIPA, a dynamic platform dedicated to connecting and empowering Indian professionals living overseas. At IIPA, our mission is to harness the diverse talents, skills, and experiences of Indian professionals to strengthen and uplift the global Indian community. Through collaboration, support, and engagement, we aim to foster a thriving network that facilitates knowledge sharing, professional growth, and cultural exchange. By building a strong network of skilled individuals, we aspire to create meaningful opportunities for development and to empower our members to make a lasting impact within the Indian expatriate community. We believe that together, we can achieve extraordinary heights. Through a range of workshops, networking events, mentorship programs, and community service initiatives, we are addressing the unique challenges faced by our community and helping our members reach their full potential. Join us on this exciting journey to build a stronger, united, and resourceful Indian professional network. Together, let's make a difference. We are thrilled to introduce the International Indian Professionals Association, IIPA, a dynamic platform dedicated to connecting and empowering Indian professionals living overseas. At IIPA, our mission is to harness the diverse talents, skills, and experiences of Indian professionals to strengthen and uplift the global Indian community. Through collaboration, support, and engagement, we aim to foster a thriving network that facilitates knowledge sharing, professional growth, and cultural exchange. By building a strong network of skilled individuals, we aspire to create meaningful opportunities for development and to empower our members to make a lasting impact within the Indian expatriate community. We believe that together, we can achieve extraordinary heights. Through a range of workshops, networking events, mentorship programs, and community service initiatives, we are addressing the unique challenges faced by our community and helping our members reach their full potential. Join us on this exciting journey to build a stronger, united, and resourceful Indian professional network. Together, let's make a difference. We are thrilled to introduce the International Indian Professionals Association, IIPA, a dynamic platform dedicated to connecting and empowering Indian professionals living overseas. At IIPA, our mission is to harness the diverse talents, skills, and experiences of Indian professionals to strengthen and uplift the global Indian community. Through collaboration, support, and engagement, we aim to foster a thriving network that facilitates knowledge sharing, professional growth, and cultural exchange. By building a strong network of skilled individuals, we aspire to create meaningful opportunities for development and to empower our members to make a lasting impact within the Indian expatriate community. We believe that together, we can achieve extraordinary heights. Through a range of workshops, networking events, mentorship programs, and community service initiatives, we are addressing the unique challenges faced by our community and helping our members reach their full potential. Join us on this exciting journey to build a stronger, united, and resourceful Indian professional network. Together, let's make a difference. We are thrilled to introduce the International Indian Professionals Association, IIPA, a dynamic platform dedicated to connecting and empowering Indian professionals living overseas. At IIPA, our mission is to harness the diverse talents, skills, and experiences of Indian professionals to strengthen and uplift the global Indian community. Through collaboration, support, and engagement, we aim to foster a thriving network that facilitates knowledge sharing, professional growth, and cultural exchange. By building a strong network of skilled individuals, we aspire to create meaningful opportunities for development and to empower our members to make a lasting impact within the Indian expatriate community. We believe that together we can achieve extraordinary heights. Through a range of workshops, networking events, mentorship programs, and community service initiatives, we are addressing the unique challenges faced by our community and helping our members reach their full potential. Join us on this exciting journey to build a stronger, united, and resourceful Indian professional network. Together.
Hello, good afternoon, and Assalamu alaikum. Welcome to the webinar series organized by International Indian Professional Association. You know, we have been bringing you a variety of topics which are relevant to our professionals, their personal life, and professional life. The last session was on income tax in India for NRIs. This time we have come up with another topic, that is the silent challenges of ADHD. What parent and teacher should know. ADHD stands for Attention Deficit Hyperactivity Disorder. Now, why we have chosen this topic is because the incidence of ADHD is increasing for many reasons. One could be the awareness has increased over the past few years, and destigmatization of ADHD. Earlier, whenever a person goes to a counselor or psychologist or a psychiatrist, people look at him as if, you know, he's mad or mental or, you know, something related to his mental health. And this is how people were stigmatized. And many cases of mental illness were going unrecognized. And then, you know, it affects their academic performance, their job performance, and interpersonal relationship in the married life as well. So this topic also has some influence on the academic struggles, the job difficulties, and social impact in the interpersonal communication and the relationship. Today we have ADHD coach. She's also a parenting and leadership coach who will explore further into this topic of ADHD. So stay tuned. First, we'll have a brief introduction of the speaker, and then we'll have a presentation from the speaker. You can note down your questions, doubts, anything in your mind. You can put down in chat box, or later we can have interactive session by unmuting yourself. Thank you for your patience. Let's have a look at the introduction of the speaker.
We are delighted to introduce Filza Jabin, a dedicated parenting, ADHD, and leadership coach with over 7 years of experience empowering parents and adults alike. Filza holds multiple certifications in leadership training, advanced play therapy, child psychology, and ADHD coaching, which enrich her holistic approach to personal development and family dynamics. Driven by a powerful mission, Filza helps individuals bring leadership into everyday life, guiding them to speak with clarity, act with confidence, and live with purpose. Through her work, she has touched many lives, creating stronger parent-child relationships and fostering environments where both children and adults can thrive. Join us as she brings her insights, experience, and passion to today's session.
Filza ji, you are welcome to this webinar as a guest speaker. Thank you for your time, and the stage is yours.
Thank you, Dr. Shafiq. Thank you, sir. First of all, I would like to thank you all for being here with me today. And thank you, IIPA, for inviting me on this platform and hosting this session. This is much needed session for all of us, not only for parents, for all of us, whoever is present here. So I am really grateful for the work you all are doing. And I'm grateful for whoever is present here, giving their time. I invite you all to be on camera, face the world. This is the right opportunity to interact and see how it feels to be uncomfortable. I know it's really uncomfortable to be on camera, but it will be amazing if all of you can be on camera and just utilize this opportunity of interaction.
Filza ji,
Thank
everybody
you,
may
thank
not
you.
be in a position to open the cameras, but whoever can, yes, they are most welcome.
Yes, sure. I completely understand, but it would be amazing if we are interacting, not just listening, another stack of thing on the shelf that we just know, rather using it in our day-to-day life. So thank you for the introduction, sir. Thank you so much. So why I chose this topic, ADHD, because it's everywhere where I can feel people are doubting themselves whether I have ADHD or not. Even adults are thinking about it. Why I have chosen parents with children with ADHD. There's a multiple reason behind it. Children are left behind. One line made me think on it really closely, which is said by Alfred Adler that every misbehaving child is a communicating child. Whenever our children misbehaves, we put them in a corner that maybe they are broken or they are naughty or something. We tag them up and we put them in the corner. But this line is very important for all of us to know that the child is trying to communicate. Now the question is, what is my child trying to communicate? What is my child willing to tell me right now? In this chaotic world, what is the impact they are going to have if we will not listen to them in the moment? Because every child is different and they are communicating in a different way. I know it's very hard for us, being a parent, myself, of 3 children. It's very hard to understand their language and their mood all the time, but what to do? Should we just give up or should we just keep trying to understand and keep promising to stand by their side? So stay till the end for any question if you have, because this is going to be a life transforming session for many of you if you all want to use this in your life. Because I'm not only focusing on ADHD, but I'm also focusing on other areas as well. So without wasting our time, let me share the screen and start the presentation. So I am ADHD parenting and adult coach and leadership coach as well. So topic today here is the silent challenges of ADHD. What parent and teacher must know. When we are dealing with any children, yes, sir, do you want to say something?
No, no, so go ahead.
Okay. So what parent and teacher must know, we see children in our day-to-day life, but we don't observe, we forget to observe what's the challenge the child must have been facing. What are they going through? So it's our responsibility to see them. At the same time, it's very tough. It's very tough. Even thinking about it, that I am not listening to what my child is trying to say gives me a setback that maybe what impact it is going to create in my child's life later on. So just look into this slide and put your hand on your heart and tell me, is this your story? Is this something which is going on in your life, that my child doesn't listen to me, throws temper tantrum, misbehaves with others, cries a lot, back talking, starting to hide or started lying, it's not paying attention in studies, gets angry very fast, doesn't sit in a classroom, doesn't pay attention in studies at all, not all worried about his future. He's not at all concerned about his future, is very disorganized, has a screen addiction, and many more. Do you all relate to any of these? Do you all relate to any neighbor of yours, any friend of yours who is going through these? Just interact in the chat box so that I can feel the energy that you all are present. I'm not just putting it on your head, but I'm also seeing that you all are present by will, with energy, with intention to transform our children's life, to help them, to support them, to be there for them. This is a silent promise which we are making all together for our children. And imagine when you're sitting here, you have the capacity to make the impact for the 7th generation. And I am not saying this, the research has said this, research has confirmed this, that if our habit, the choices which we are making today, it can last the impact till the 7th generation. Just imagine the impact and start taking action now and just be in the moment with intention that we are here to support our children, our generation. We are passing on something. This is not just a session. This is something that we are promising to pass on. Okay, so let's move forward and understand more about it. There are many children who are addicted to screen. Okay, what can be the impact of on ADHD children having screen addiction? Have you ever thought about it? Have you ever thought that what's the condition and what can be the impact for the life on a child if he has ADHD or any other developmental delays or autism or any other challenge in his life, and he got screen addiction? Have you ever thought about it? We'll discuss more about it. Stay tuned. ADHD and anger issues are also associated. Okay. Teenage challenges. Teenage challenges are very common. I also have two teenage child, 15 and 13-year-old. What if it is combined with ADHD? We'll get to know. Language delay. Many parents are facing this challenge that the children are not speaking, unable to speak. They don't have the words to speak. At the same time, they have attention deficit. I'm meeting many parents that they are clueless why this is happening and how they can help them, what to do in the right moment. So you're in the right place. Stay tuned where you are. And if you want to make a shift in your life and in your friend's life, just learn what we can do and what impact we can create. ADHD and overeating. This slide triggered my son today. This is the story I wanted to share with you all. This slide. Why can't a normal person just eat? Why are you writing it as overeating? Why do we can't just think about filling ourselves unless it is very much full? Because he loves food and this triggered him. Okay, and how it, when ADHD is associated, can my child eat too much? There are many parents who said that my child keeps on eating, keeps on searching for something or the other in the whole house, and they just keep munching. Okay, we'll know about it, why these things are happening. So let's understand what is ADHD. Attention deficit hyperactivity disorder is a neurodevelopmental disorder characterized by persistent patterns of inattention, hyperactivity, and impulsivity. If these three things are present for 6 months, there are some symptoms which is present for 6 months, then we can diagnose that the child has ADHD. Okay, this diagnosis is given by psychiatrists and psychologists on the basis of DSM-5, Diagnostic and Statistical Manual number 5, which worldwide doctors are using to diagnose. Okay, so what is neurodevelopmental disorder? When we are born, our neurons are developing, our neurons are opening up, acquiring a lot of skills. Okay, age appropriate and stage appropriate development is necessary. So what's happening in ADHD? The prefrontal cortex is not getting developed. It's a complete biological condition. Okay, it's not a joke. It's a biological condition. What is happening? And this can happen even after your child is born completely normal, and this condition can develop because of several reasons, and we'll talk about it. Okay, ADHD can typically manifest in childhood and can continue till adulthood. Can be there till adulthood if we will not address it. Types of ADHD: predominantly inattentive presentation, symptom of inattention, but not hyperactivity and impulsivity. It can be there. Predominantly hyperactive impulsive presentation, symptoms of hyperactivity, impulsivity, but not inattention. Okay, hyperactivity and impulsivity is there, but inattention is not there. There is a lot of hyperfocus. Okay, children are focusing sometime too much. Okay, and combined presentation is also there. This is very common in children, specifically in boys. Symptoms of both inattention and hyperactivity, impulsivity is present. Okay, so now let's understand this. Is my child born with this? This is the big question many parents ask, that if this condition is present in me or in my child, is my child born with this? Well, it can be, and it can develop also because of several reasons. It's not that your child is not born with ADHD. They can be born with ADHD, and because of some neurodevelopmental disorders like autism and any other condition, developmental disorders, it can develop, ADHD can develop. Okay. Why my child is hyper focused? Why is he focusing on screen? Because they lack one very important neurochemical, which is dopamine. There is some dysfunction in dopamine, and that's why whenever they're getting that hit of dopamine with something, especially with screen, that's why I've used this picture for screen, they are hyper focusing. Many people say this, but they are taking interest in something which they want, but they are not listening to us. Okay, so they are hyper focusing on something which is giving that neurochemical and not paying attention, which is necessary for them in other areas. Okay. children with ADHD can harm themselves also by biting themselves, by banging their head. Anger issues can be there in them. They can have a fight with peers. These are the conditions which are present. I would like to ask you all, is there anyone who is facing any of the challenges with their children? Is there anyone who is facing something? Let me just see in the chat. Yes, Kaniz, I am facing it. Kaniz is, I resonate with many of these. Okay, my child is addicted to screen time. Okay, Aisha. Okay, yes, I face majority of these, Archana. Yes, few of them. So can you tell me what exactly you think or believe when your child is facing all these things? Not able to study according to his age. Yes, absolutely. And that reason can be ADHD and other developmental disorders or other developmental delays. Okay, so I invite you all to pay attention what exactly your child is facing. These are the things can be there, and reason can be many different. Okay, just try to observe your child because you are the closest one. And what can be the causes of ADHD? Genetics can be the big cause. ADHD tend to run in families, suggesting a genetic component which is running in the family. Maybe father or forefather was like this, and it is getting carried by children. Environmental factors also, exposure to environmental toxins, alcohol or tobacco during pregnancy. And I'm not talking that mother is having tobacco or alcohol. Even if father is also going through it and mother is a passive smoker, and even if father is alcoholic, it can affect in the child. Okay. Brain function and structure, a difference in brain structure and function, particularly in the areas controlling attention and activity level, which is prefrontal cortex. They have a different, research has shown that their frontal lobe is little shrinked, little shorter than the normal neurotypical people. Okay, so this is very significant. We get to know recently one of the adults, she was asking me, I was like really shocked to know that my brain is small. My brain is there any test I can go for and get it diagnosed that how my brain is working? Can I do any blood test or something? So I told her that there is no such blood test to get tested for ADHD, but yes, functional MRIs are getting done in many places. So you can get it done at the same time. Psychometrical assessment, few questions are the best way to diagnose ADHD. And you can do it in any government centers. I would suggest to go for any renowned government center. India is providing a lot of assessment. It's helping parents and adults also to diagnose, and immediately people are running after medicine immediately. I'm not at all saying that medicine is not helping. Medicine can help you, but only going for medicine and relying on medicine for a longer period of time can be dangerous. Recently, I've come across with a parent whose son was hyperactive, and he started giving medicine at the age of 5, and now his son is 19, not speaking, not learning any skill, not going to school. Like, no development is happening because of the side effect of medicine, and many other reason is also associated. I'm not saying that it is just the side effect of medicine. Okay, so now also he's on medication, different medication is going on. So be very careful before choosing medicine. Ask 10,000 extra questions to doctors. They are for you. They are there to help you educate yourself. When I came to know that my younger son is little different than elder son, then I started studying myself. I did a diploma in child psychology, did master's in psychology, and I started learning about it myself, because I was knowing that this child is little different, and being a doctor's wife and a doctor's daughter, I am always surrounded by many doctors. At the same time, I have experienced lack of awareness about these developmental delays, including autism, including other developmental delays like dyslexia, dyscalculia, dysgraphia, and many more. There is lack of awareness which I've experienced. Then I decided that it's very important for me to know deeply about it if I want to help my child and bring him out of the condition, whatever he has. Okay. So my youngest son was developing little late than my elder son, and he had many health challenges, and he was going through a lot. At the same time, I and my husband saw a lot of autistic traits in him, and developmental delays were there. But he is 13-year-old now. He is with that condition, but he's completely going to a normal school, doing good in his academic, studying properly, but with proper guidance. Okay. So it is very important for me to educate myself as a parent. I cannot just go and blame to any other doctor or any other system, schools, to not having those things in their school and system. I cannot afford to change system to change and start working on my child. Then I cannot. This is going to cost me a lot. Well, I invite you all to see what is your child condition and start working from there. Start helping him, because this is a calling for you. If your child is misbehaving, try to see it from this perspective, that my child is seeking help. No, 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 no. My child is not naughty. My child is not bad. He is not like his chacha or his father or someone. He is communicating. What is my child communicating, trying to communicate to me now? Okay, this is the thing. Shift your mindset and start seeing from there. Okay, let's move forward and understand, what should I do after knowing? What should I do? Why should I worry about it? Why should I worry about it? Let's understand. Over 80% of children who are diagnosed with ADHD have comorbid conditions like mood disorders, impulse disorders, and any other psychiatric disorders are up to 10 times higher in those with ADHD than normal people. ADHD people's chances are 10 times higher than a normal population. And I'm talking about adults here. I'm not talking about children. Okay. And what are those disorders? Up to 50% with ADHD will have oppositional defiant disorder. 50% of ADHD will have autistic tendencies. 60% will have sleep disorders, learning disorders like dyslexia, reading problem, which is known as reading problem, 76%. Maths and anxiety problem, dyscalculia, up to 30%. Written expression dysgraphia, okay, 65%. Reading comprehension, up to 52%. These are the disorders, developmental disorders associated. And what are the other ADHD progression from childhood to adulthood? And this is very important. This made me start a program for adult as well. Recently, I've started supporting adults from 5 to 6 months who has ADHD, who believe that I have ADHD and the symptoms are matching, I don't know, and they're reaching out to me, and I started giving them a structured program. Anxiety is very common. 42% of ADHD people will have anxiety and depression, 63%. Okay. And often this is showing together. Sensory processing problem is very common with people who has ADHD. And what is sensory processing problem? With 5 sense organ, our brain is acquiring message to retain and execute the knowledge and take action. And if any of our sense organ is disbalanced, is hypersensitive, it's taking time to execute the knowledge which they have. Okay? To express. That's a sensory processing problem. Obsessive compulsive disorder, 33%. Mood disorders are very common in those people with ADHD. 38% manifest persistent irritability and intense or disproportionate anger. Up to 40% of those ADHD will have hoarding disorder. How many of you have seen people just buying things, filling up their house, and maybe it will help me later on, and that later on never comes, because when I'm searching for that thing, my mind is not working to bring that out and use it, because I've kept it for later on. Now when I'm searching for it, my mind is not working. Where is it now? Let's go and buy another one. Let's go and have another one. It's very easy. But we cannot stop ourselves from hoarding things. How many of you have experienced this, like adults around us like this? Just stay in the moment, stay aware, and start helping yourself. What are the ADHD and associated disorders? Oppositional defiant disorder, conduct disorder, substance use disorder, sleep disorder, eating disorder, tic disorder, sensory processing disorder, anxiety and depression. I would like to talk about conduct disorder. Children who are suffering from having a conduct disorder, higher chances of being in the antisocial personality disorders. It can transform into antisocial personality disorder later on when they are adult. Just for the awareness, I made this slide. I tried gathering all the information for awareness. ADHD is making our children overwhelmed. They don't know why things are happening with them, why they are feeling like this, why others are doing same thing without any notes, and they are remembering also why they are unable to remember things. Okay. ADHD can lead to academic failures. If your child is not progressing, the symptoms will be the highest. The symptoms will show up, like, because this is a transition period for them, and they will start falling in their academics, and they will not understand. It will be hard for them to organize. It will hard for them to write and maintain notes, and it can lead them to academic failures. They feel broken from inside. Even if they are misbehaving, they are communicating that I'm not feeling good from inside. I'm not feeling appropriate inside. Please help me. Adults around me, please help me know about my condition and help me. Okay? And how can we do that? Stay till the end. You'll get to know about it. And sometimes they're giving up. Giving up, I don't want to use the exact word, but they do give up, not only by giving up their life, but also giving up some subject. Like, I'm not appropriate person for this subject. I'm not appropriate for this one. So they start giving up and start settling down in their life. Maybe I cannot aspire more. Maybe I'm not made for this. These areas are not for me. So they start selecting and deselecting things of their life. Because of their condition, they are aware of it, that they are unable to handle this much of things on the table. Now they start giving up things. Okay. Now, what should I do as a parent? Let's understand this. Before this, I would like to ask if there is any question from anyone. Non-verbal poor communication. Okay, Kinaz has written non-verbal poor communication. So immediately you meet to any psychiatrist or psychologist and start his speech therapy, because this is very important. Hyperactivity with lack of attention. Yes, please. Self-harming behavior. This is very important, Sumaya. If your child has a self-harming behavior, what is your child trying to communicate? What is the problem your child facing? Sit with your child. Sit with your child and understand what's going on. Is there any question up until now? Is there anything which you want to understand? Any question, anyone?
They can unmute and ask.
Yes, you all can unmute and ask.
अगर आप हिंदी में बोलना चाहें तो भी नो प्रॉब्लम,
हाँ,
पूछ सकते
नो
हैं।
प्रॉब्लम, आप हिंदी में भी बोल सकते हैं. I can talk to you in Hindi, English, and Bengali.
एक्चुअली उसका सेल्फ हार्मिंग, अस्सलाम वालेकुम, एक्चुअली उसका सेल्फ हार्मिंग बिहेवियर इसलिए है कि उसको स्पीच नहीं है.
ओके,
बहुत लिमिटेड बात करता है.
कितनी उम्र है बच्चे की?
13 years.
13 years है. तो सेल्फ हार्मिंग बिहेवियर है, इसको रिड्यूस करने के लिए कुछ आप कोई मतलब कोई गाइडेंस ले रहे हैं?
नहीं, यहाँ पर तो बहुत कम अवेलेबिलिटी है इस टाइप के, बहुत कम है यहाँ पर. मतलब हम हमारे एज ए लिविंग इन रियाद, इट्स वेरी डिफिकल्ट टू फाइंड.
सुमैया जी, 2 weeks के बाद हम एक सेशन ला रहे हैं, चिल्ड्रन विद स्पेशल एजुकेशन नीड्स. तो इन बच्चों को मतलब जो थेरेपी की जरूरत पड़ती है या कैसे इवेलुएट होता है, लोकली हम क्या कर सकते हैं जब रिसोर्सेज अवेलेबल नहीं है, तो इस बारे में हम बात करेंगे. एक 2 weeks के बाद एक सेशन आ रहा है, तब तक थोड़ा आपको सब्र करना पड़ेगा. लेकिन आपका कंसर्न वैलिड है, ऐसे बहुत से पेरेंट्स हैं जिनको ये मसला आता है, इसीलिए हम वो सेशन ला रहे हैं. थोड़ा सब्र कीजिए, इंशाल्लाह हम उसको आपके सामने लाएंगे.
जी, जज़ाकल्लाह.
Thank you sir for doing the work.
Yes, actually, I had a question. If a child is a 13 or 14-year-old right now and is not able to cope up with his studies, basically, yeah, dyslexia ho jaye ya kuch bhi, but not able to cope up with the languages, he average at school. So, what will be the future of such a child? And
future can be amazing, Fatima. Future is amazing for the child who is really willing to do it. How will you bring the willpower? That's the main thing. This is what I have faced with my child, that no matter what the condition is, if I am able to keep up the willpower, they are going to do amazing in their life. No matter what the condition is, if it is dyslexia and they are unable to study, how as a parent I'm helping them to narrow it down for them to understand the subject properly. Like, for example, very simple example, and I never fail to give this example to anyone and everyone around me, that I have 3 children, but I never come and discuss their results at my home with each other, even with their teachers even. It's not required, because it was hard for me to pay attention individually on them. It's very easy to come and compare my other children with someone who is unable to cope up. Okay. And with teachers also in school, I don't go and I complain. I just go and see where my child is lacking and I start working. I communicate with their tuition teachers, with school teachers, and start working. My son just gave his board exam and I'm not at all feeling the need to come and discuss his numbers. Not at all required. Why? There's an intention behind it, because every child needs a special attention. How can I reduce the pressure of my child so that he can love studying? Humankind has a need, a craving of learning, but this craving is missing from all of us. And the reason behind it is comparison. Silently, we all are comparing ourselves. We end up comparing our children. comparing our surrounding. We do that. So Fatima, start narrowing it down for your child, make it easy for him so that he can start loving the subject, whatever it is. Maybe not all the subject, which subject he is loving, and there is a lot of opportunity available out there. Okay, am I able to answer the question, Fatima?
Yes, actually, the curriculum doesn't support it. As we know, the CBSE curriculum, I don't know how much they'll support. They'll like he's very difficult for him, especially in the languages, Urdu and Hindi. So I wanted to
Absolutely.
know, is there any exception in the higher grades? Now they're just passing him out, but later on, will he be able to pass even the basic 10th and the later on?
Yes, they will. They will. You just need to have that communication with the teachers. You have that communication with the teachers and know what can you do to support your child individually. Rather comparison, make it easy for your child, even if he is in a higher classes. Yes, sir. Were you saying something?
फातिमा जी, क्लासेस में हमने थोड़े स्कूल्स को सर्वे करने की कोशिश की। वहाँ पर नंबर्स ज़्यादा होते हैं, द नंबर ऑफ द स्टूडेंट्स पर क्लास। तो टीचर जो है इंडिविजुअल अटेंशन शायद उतना नहीं दे पाती है जितना वो स्पेशल एजुकेशन नीड्स वाले बच्चों के लिए ज़रूरत होती है। अगर आपका कंसर्न सिर्फ लैंग्वेज से है तो आप प्राइवेट ट्यूटरिंग से भी इम्प्रूव कर सकते हैं। सो यू डोंट हैव टू डिपेंड ऑन द स्कूल इटसेल्फ। जहां आपको लगता है कि आप प्राइवेटली कुछ कर सकते हैं अपने बच्चे के लिए, आई थिंक वन नीड्स टू डू दैट। वरना क्या होता है कि बच्चे को अगर बेसिक रीडिंग राइटिंग और बेसिक मैथ्स अगर नहीं आता है तो आगे जाके प्रॉब्लम होगी, इररिस्पेक्टिव ऑफ वो टेस्ट में कितने मार्क्स ले रहा है, कौन से ग्रेड में प्रमोट हो रहा है। इररिस्पेक्टिव ऑफ दैट, अगर उसको बेसिक लैंग्वेज रीडिंग राइटिंग एंड बेसिक मैथ्स अगर नहीं आता है, फॉरगेट अबाउट स्कूलिंग, इवन लाइफ स्किल्स भी वो डेवलप नहीं हो पाएंगे, ही कैन नॉट लिव इंडिपेंडेंटली। तो आप कोशिश करें, आई मीन नॉट ओनली फॉर यू, एनी पेरेंट, बच्चे को बेसिक रीडिंग राइटिंग एंड बेसिक मैथ्स इतना तो आना चाहिए, एंड हाउ टू इंटरेक्ट विद द पीपल, तो वो कहीं ना कहीं वो जिंदगी जी लेगा। तो हम उसको फोकस करेंगे तो मेरे ख्याल में बच्चे की लाइफ बन जाएगी इंशाल्लाह।
जी,
सर,
जज़ाकल्लाह।
एक्सक्यूज मी, मेरा एक आंसर है, एक क्वेश्चन है कि जो हम यहाँ पर फेस कर रहे हैं मेन प्रॉब्लम कि यहाँ पर कोई फैसिलिटी नहीं है स्पेशल नीड्स बच्चों के लिए, इन केस स्पेशली।
जी, इसी को लेकर मैंने कहा कि एक सेशन हम ला रहे हैं।
नहीं तो सर, इसके लिए एक बच्चों का एक स्ट्रक्चर्ड माहौल में सीखते हैं ये बच्चे, तो उनको कुछ स्ट्रक्चर्ड माहौल की जरूरत होती है। तो
जी
ये कोई हिंदी लोगों के लिए तो बिल्कुल ही अवेलेबल नहीं है यहाँ पर
जी,
ये चीजें।
ये मतलब जैसा कहते हैं ना कि इट टेक्स अ विलेज टू रेज अ चाइल्ड, इसका मतलब ये है कि सिर्फ आप और मैं या फिल्जा जी इस प्रॉब्लम को सॉल्व नहीं कर पाएंगे। यहाँ जो वेल टू डू लोग हैं जो भी, ठीक है,
जी
उनको भी ये सोचने की जरूरत है कि भाई जहाँ ऐसे फैसिलिटी नहीं है तो बहुत से पेरेंट्स सफर हो रहे हैं, बच्चों का फ्यूचर जो है वो जेओपार्डाइज हो रहा है। तो
जी।
हम उस चीज को भी हाईलाइट करते हुए अपनी जो टीचिंग क्वालिटी है उसको कैसे इम्प्रोवाइज कर सकते हैं उस पर ध्यान देने की
नहीं
जरूरत है।
सर, टीचिंग
हम,
क्वालिटी नहीं, हमें एक स्कूल बनाना है ऐसे
हाँ,
बच्चों का,
वही वही तो
जो
बात कर रहा हूँ मैं,
एक
टीचिंग
स्ट्रक्चर्ड
क्वालिटी का
माहौल
मतलब।
देना है बच्चों को।
डॉक्टर साहब, अस्सलाम वालेकुम, दिस इज समीउद्दीन। डॉक्टर साहब, सॉरी फॉर इंटरप्शन, मैं एक आंसर दूं मैडम को, एक सॉरी फॉर इंटरप्शन।
समी होल्ड ऑन। तो क्वालिटी की बात है, तो जब
जी
स्पेशल एजुकेशन नीड्स की हम स्कूलों को ये टॉपिक लेकर गए थे, तो एक तो स्कूलों में नहीं था इस तरह का कॉन्सेप्ट, और चूंकि बच्चे ज्यादा एडमिशन्स के लिए आते हैं तो वहीं फिल्टर होकर वो बच्चा बाहर निकल जाता है, यानी उसको एडमिशन नहीं मिलती है, ठीक है।
जी
अगर मिलती भी है तो उनके अंदर वो स्पेशल एजुकेशन नीड का केयर सेंटर नहीं है। सिर्फ एक स्कूल हमने देखा, जिनका नाम मैं यहाँ लेना शायद मुनासिब नहीं समझता, तो उनके पास थोड़ा बहुत वो है सर्विसेज, लेकिन अगेन हमने उनको कहा कि भाई वी आर विलिंग टू ट्रेन योर टीचर्स, हमें सिर्फ टीचर्स कनेक्ट करा के दीजिए। अगर हम
सर,
इतना
हम
भी कर
पेरेंट्स
रहे
खुद
हैं
रेडी
तो
है टीचर्स बनने के लिए।
जी,
अगर आप इनिशिएटिव ले तो हम पेरेंट्स खुद रेडी है टीचर्स बनने के लिए। आई एम वेल
हाँ,
एजुकेटेड,
इट्स
आई एम
वेलकम
मास्टर्स
जी,
एंड बीएड
वेलकम
आल्सो।
वेलकम मूव। हम कोशिश कर रहे थे कि ज्यादा से ज्यादा पेरेंट जो है जो इंटरेस्टेड हैं टीचर के, तो हमने टीचर ट्रेनिंग,
जी
अर्ली चाइल्डहुड टीचर ट्रेनिंग कोर्स भी हमने लॉन्च किया। बहुत ही कम लोग ज्वाइन हुए, आई डोंट नो शायद आप तक उसका नोटिफिकेशन नहीं पहुंचा होगा। तो काफी एफर्ट लगाए हमने, स्कूलों पे गए, और स्कूल मैनेजमेंट इज नॉट इंटरेस्टेड इन सेंडिंग देयर टीचर्स। तो ये इस तरह का रेस्पॉन्स आता है, तो हमारी भी लिमिटेशन है ना कि भाई हम भी इंसान हैं, एक लेवल के बाद हम हिम्मत हार जाते हैं। तो आप जैसे लोगों का अगर हमें सपोर्ट रहा तो इंशाल्लाह वी कैन डू वंडर्स इंशाल्लाह। समी भाई।
सर इसके लिए
Yeah,
हमें बहुत
adding
सारे लोगों को पहले स्पीसीज पर कन्विंस करना होगा।
जी जी
पहले आप एक प्लान बनाइए और लोग
जी, अगर आप कुछ
कन्विंस कीजिए
इनिशिएटिव
सर।
लेके हमसे जुड़ना चाहें तो मोस्ट वेलकम मैम।
as per the
सर
time
कैसे
concern,
यहाँ पर
Dr.
कैसे सर मैं
I want
रियाद
to
में रहती
add
हूँ
one point.
तो मैं आपसे
Can I
कैसे
answer to ma'am, please?
कनेक्ट हो सकती हूँ?
समी
Ma'am,
भाई, देयर इज ओवरलैप, थोड़ा होल्ड ऑन कर लें।
प्लीज, मैं रियाद में रहती हूँ सर, तो
जी
मैं कैसे कनेक्ट हो सकती हूँ और मुझे कैसी फैसिलिटीज मिल सकती है ये?
जी, अभी एक जैसे सेशन क्लोजिंग के करीब आ जाएगा तो आपको व्हाट्सएप ज्वाइनिंग लिंक भेजा जाएगा, ठीक है।
जी
और उसके बाद एक फीडबैक फॉर्म भी आएगा। अगर व्हाट्सएप ज्वाइनिंग लिंक नहीं तो कम से कम फीडबैक फॉर्म में आप अपना नाम और नंबर, आप जो भी कॉन्टैक्ट डिटेल डालना चाहें और कोई कंसर्न
सर,
डाल
ये जो
दीजिएगा।
ऑनलाइन जो थेरेपीज देते हैं इट इज नॉट इफेक्टिव सर।
सही सही, नहीं
ऑनलाइन
आप,
थेरेपी
नहीं
मीनिंगलेस।
आप, मैं आपकी बात से 100% सहमत हूँ, लेकिन
जी
ये है कि हम जब उसको सॉल्व करने की कोशिश कर रहे हैं तो हमें वो हेल्पिंग हैंड्स नहीं मिल रहे हैं। तो इंशाल्लाह आपका जो मैसेज है, मेरे ख्याल में बहुत से लोगों, अब ऑलरेडी 87 लोग ज्वाइन हुए हैं, तो उन तक तो
जी
बात पहुंची है, उनके थ्रू लोग ज्यादा लोगों तक बात पहुंचेगी इंशाल्लाह। तो विल डू समथिंग ऑन दिस। तो आप
सर प्लीज
अपना
आप
जो
इसमें से
इंटरेस्ट,
सॉर्ट आउट कीजिए कि रियाद में कितने लोग रह रहे हैं, फिर से हम सब मिलकर
नहीं
ये
मैम,
कुछ इसका वो करते हैं।
सेशन का टाइम स्लॉट कम रहता है, तो आई डोंट वांट टू
जी
टेक वन क्वेश्चन नो
ओके
फॉर अ लॉन्गर पीरियड। तो आप अपना जो
ओके
भी
सर।
कंसर्न आप डाल दीजिए, हमको मिल जाएगा इंशाल्लाह। हमारे जो लेडीज विंग है वो आपसे कनेक्ट करेंगे इंशाल्लाह, ठीक है।
ओके थैंक यू।
समी भाई।
Ma'am, I added one more an important information. Ma'am, I'm also a IIPA executive member. We raised to embassy also. So you as a parents also we need hands. We came up to support the community in all our free time or whatever weekends that Dr. Saab said. Now currently we have very short of time. So we raised, I myself raised many times. Okay, being doing a social work, I get like monthly many cases. Okay, so already हम लोग ये एम्बेसी में भी रिक्वेस्ट किए हुए हैं. So what Dr. Saab said earlier, answer to your question is well-to-do people, and we need the knowledgeable people in that area. As you are coming up, that you are well educated, so इसका solution यही है. Even the parents should, any citizen should raise this to the embassy also, and well-to-do people and like 2-3 groups can join and start something. As you are saying, physically online will not help. Everything will help, everything will add some knowledge, everything will solve something, okay, by giving such sessions. तो बेफिक्र है, inshallah it needs some time. So embassy में भी आप लोग भी raise करना है, embassy website पे जाके. This is my added some information to the question.
Thank you, Sami bhai. Any other question quickly before Filza ji will continue with her presentation?
So I can read some of the question here. It's given how to deal with kids who has the habit of procrastination. So Shabnam, let me tell you, there is always a reason behind every procrastinating person, not only the child, but for adults also. There is a reason. So if you are able to understand the reason behind it and you can block that reason or give him the support through that, that would be really helpful. For that, we need to understand few things. Let me just start sharing the screen again, and I will share what we can do. What should I do as a parent to help our children? Okay. Know your child's condition. What is your child condition? Whether your child has dyslexia, dysgraphia, dyscalculia. There are many psychometrical assessment is available, and any other thing, any other developmental delays or learning disabilities. There are two things, developmental delays and learning disabilities. Keep that in your mind so that you can go and ask question to your healthcare provider so that they can help you. Okay, and start seeing your child individually, one person at a time, one hand at a time. Okay, and this is a perfect opportunity for me to hold my three children's hand. Okay, know your child. Number 2, support your child, not only ADHD child. I have written ADHD because this session is specifically focusing on ADHD child. Support your child. Whoever is saying what I don't know, but I must support my child with an intention, niyat bana karke mujhe isko aage tak pahunchana hai, not with a question mark. Okay, नियत जब हम बनाते हैं, जब हमारा इंटेंशन बनता है, तो it's not supposed to be there with a question mark. होगा कि नहीं होगा. Well, Braille as a language is written by someone who was blind. What else example do we need? What other example do we need? Okay. So let's move forward and support our children. Give them appropriate scaffolding. Scaffolding की जब मैं बात करती हूँ तो यहाँ पर ये पिक्चर देखिए, जोन ऑफ प्रॉक्सिमल डेवलपमेंट की पिक्चर, जो लेव वाइगोस्की ने, रिनाउंड साइकोलॉजिस्ट लेव वाइगोस्की ने बहुत पहले बात की थी. ये जो ग्रीन पिक्चर है, ग्रीन सर्कल है, व्हाट योर चाइल्ड कैन डू, व्हाट आई कैन डू, ये हमारा trait hai, inborn capacity, age and stage appropriate, not only age and stage appropriate capacity hai. What I can do with help, ये वाला जो पर्पल वाला सेक्शन है, this is called zone of proximal development. ये पर्पल वाला सेक्शन किस चीज से हम बढ़ा सकते हैं. अब एक चाइल्ड की कैपेसिटी ये ग्रीन से पर्पल के तक हम कैसे पहुंचा सकते हैं. लेव वाइगोस्की ने कुछ चीजों की बात की, स्कैफोल्डिंग में से नॉलेजेबल अदर्स, रिसोर्सेज, इंस्टीट्यूशन, ट्यूशन, जो इंडिविजुअल एजुकेशन प्लान, व्हाटएवर इट इज, स्कूल, सारी चीजें इसमें आ गई. ये हो गया जोन ऑफ प्रॉक्सिमल डेवलपमेंट, द डेवलपमेंट विच इज डन विद द हेल्प ऑफ स्कैफोल्डिंग. अभी ये एक्स्ट्रा ब्लू सर्कल क्या है फिर? व्हाट इज दिस एक्स्ट्रा ब्लू सर्कल? दिस इज समथिंग what I can't do. No matter how much pressure we give, no matter how much support we give, it is not possible for the child to acquire this knowledge or this thing. They cannot do the work no matter how much we pressurize them. So it is very important to understand what your child can do now at this point of time, whether it is reading, writing, or understanding or behaving, whatever it is. What is the scaffolding you are ready to provide? What is affordable? If you are staying outside India, I know it's very difficult, very, very difficult. At the same time, what are the resources available around you? Get to know that, learn about it, take your child there, try different things and understand कि उसके लिए क्या work करेगा, and start gathering resources for your child and give them scaffolding and stop pressurizing. This blue line is stop pressurizing inappropriately. Otherwise, they will start rebelling. They have all the capacity to rebel and say no to you. लेटर ऑन बड़े बच्चे जो होते हैं वो गुस्सा करके या फिर कुछ बोल करके वो रिबेल करते हैं. छोटे बच्चे कैसे रिबेल करते हैं? वो जो उनका acquired skill है, they will not use it. They will start regressing. Okay, they will start regressing. वो अपना जो भी acquired skill है वो बोलेंगे ही नहीं. They will not communicate with you. Not only communicate, they will not use it whenever it is needed for them, because they can say no in their own way. So it is very important for us to know what is this zone of proximal development for my child individually. If I'll talk about my own self, मेरी अपनी क्या capacity है, what is required for me to become better coach, then I can do. What I can't do, no matter how much training I take, I cannot become an MBBS doctor. Okay, so this is what I can't do. So I need to see and gather all the resources in my genre, in my area. Okay. And then help them organize things by giving some notes, sticky notes, whatever it is. Help them organize their thoughts and whatever they are feeling. So channelize their energy. They are highly energetic. Channelize their energy. And I'm talking about ADHD children. Give them, put them into sports. It is as important as studies. Put them into something which they love, where they can have a constant movement. Research has shown कि जो भी बच्चे sports में होते हैं, they are less depressed, less anxious and less stressed. They are more into coping. They are more into going and achieving. They learn teamwork faster. To start giving your children into sports, don't even think about it कि ये कल को क्या काम आएगा, what will help, how will it help in their academic. It is definitely going to help your child in academics and in their other part of their life also. Okay, now this is what we do for our children. not all of the time when it is required. And this is for the eldest son, this is for the younger son. We do it for us. This is for us, not for them. It's for us to remind ourselves what is what and create that boundary. Our brain is working best with the help of boundary, appropriate boundaries, limits and boundaries. If I will give a basket of chocolate to my child will lose interest in that. What is happening? The brain is rejecting the chocolate now. Now go for something more. Ask for something more. Okay? They will ask for something else, but they will not like the chocolate. If you want to increase the value of a chocolate, you have to reduce the amount of chocolate you're providing to your child. The appropriate boundary with kindness, like with intention that you want to make your child. It is very much needed. This is a very important line. One strong relationship with a caring adult can be crucial for a child's ability to thrive even in the face of adversity, said by Dr. Ann Marston. One strong adult is enough. If you are ready for your child, it is enough. One of the parents, she is very near and dear to me. She said, my husband is not participating. I don't have that environment. Well, you are enough. Let's come and think in this way. What can I do? How can I enroll others around me? You are enough. Start from this point and start helping your child. Help them level themselves up. Wherever they are, have a short target and help them level themselves up. And give them that, that clear vision where they get to do, where they get to go and what they need to do in the moment, so that they can feel as an achiever. They can be relaxed as an achiever. My intention behind, and make impossible possible for them. Be that bridge as a parent, as an adult, as a teacher. Be that bridge for your child. You are enough. Okay, so I am done here with my presentation. Thank you so much for being part of this. And I just want to know if there is any other question related to this. I would love to answer. It's very special case.
When you are going through the chat box, Filza ji, I will just try to summarize for those who are comfortable with the Hindi or Urdu. So you just go through the chat box for the questions. मैं ऑडियंस को थोड़ा समराइज करने की कोशिश कर रहा हूँ कि ADHD जो है एक न्यूरो डेवलपमेंटल डिसऑर्डर है, जिसमें न आपका दोष है न आपके स्पाउस का। तो जो जेनेटिक फैक्टर्स बता रहे थे, या फिर जो है टोबैको, अल्कोहल, इस तरह की जो फैक्टर्स हैं, वो पॉजिटिव इसमें है, लेकिन कुछ चीजें होती हैं आपके कंट्रोल में हैं, कुछ चीजें आपके कंट्रोल में नहीं हैं। जब चीजें कंट्रोल में नहीं हैं, तो व्हाट बेस्ट वी कैन डू, हम क्या अपने तौर से क्या कर सकते हैं ताकि बच्चे की जिंदगी बेहतर से बेहतर हम बना सकें, उस पर हमें कोशिश करना है। मिसाल के तौर पर जो सिम्टम्स शुरू में बताए गए, फिल्जा जी ने बताया कि भाई इनअटेंशन है, इम्पल्सिविटी है, हाइपर एक्टिविटी, यानी बच्चा जो है आपकी बात नहीं सुनता है, या सुना भी तो जो है आपकी तरफ रेस्पॉन्ड नहीं करता है, या फिर जो है भूल जाता है कोई चीजें। तो इस तरह के सिम्टम्स अगर समझें 6 मंथ्स या प्लस उससे ज्यादा ड्यूरेशन पे हो रहे हैं, तो आपको डेफिनेटली आपकी कंसर्न बनती है। यहाँ एक चीज का ध्यान रखना है कि ये 2 सेटिंग्स कम से कम होनी चाहिए कि भाई आप बच्चा जो है हाइपर एक्टिव लग रहा है या जो भी बिहेवियर प्रॉब्लम लिख रहा है, लेकिन घर पे ऐसा है, लेकिन स्कूल में जो है कंप्लेंट कोई नहीं, बहुत ही क्लास में कोई रिमार्क नहीं है टीचर की तरफ से। तो यहाँ थोड़ा डाउटफुल होता है कि भाई इज इट ADHD या कुछ डिसिप्लिन का प्रॉब्लम है, ठीक है। या फिर टीचर जो है रिपोर्ट दे रही है कि बच्चा जो है वो बहुत नॉटी है, इज नॉट लिसनिंग, एंड वो वहां से वो रिपोर्ट आ रहा है, लेकिन घर पे आप देखते हैं कि बिल्कुल ही फाइन, मतलब कोई आपने कोई नोटिस ही नहीं किया। तो ये ADHD के डेफिनेशन में नहीं आते हैं, ठीक है ना। तो एक उसके क्वेश्चनर होते हैं, अगर आप चाहें तो हम उसको व्हाट्सएप ग्रुप में भी डाल सकते हैं, कि एक क्वेश्चनर होता है पेरेंट के लिए कि भाई आपको टिक करने होते हैं कि हाँ आपने बच्चे में ये चीजें ऑब्जर्व की हैं, ठीक है। फिर टीचर के लिए भी एक क्वेश्चनर शीट आती है, वो हम आपको टीचर को रिक्वेस्ट करके देना होता है कि भाई देखें हम घर पे जो है बच्चे के अंदर ये फलां फलां सिम्टम्स नोटिस कर रहे हैं, दैट्स वाई अगर आप हमें ये क्वेश्चनर आंसर कर देंगे तो हमारे लिए आसान होगा। तो शी विल आल्सो टिक कि भाई फलां फलां उन्होंने ऑब्जर्व किया है, एंड देन बेस्ड ऑन कितने नंबर ऑफ टिक्स होते हैं, स्कोरिंग होती है। जब स्कोरिंग होता है तो फिर वो किस तरफ ज्यादा जा रहा है, इज इट इनअटेंटिवनेस है या इम्पल्सिविटी की तरफ, हाइपर एक्टिविटी की तरफ जा रहा है, तो वो डायग्नोस करने में भी आसान होती है। और जो भी आप काउंसलर के पास जाएंगे, साइकोलॉजिस्ट के पास जाएंगे, उनके लिए आसानी होती है डिसाइड करने में। वरना जस्ट बिकॉज समबडी इज नॉट एट होम डजंट मीन ही इज एडीएचडी। ठीक है, एक तो ये चीज होगी। दूसरा ये है कि इस तरह के बच्चों को अगर जल्द से जल्द आइडेंटिफाई करके जल्द से जल्द थेरापी इंट्रोड्यूस नहीं किया गया, तो आगे जाके उनकी एकेडमिक्स में बाधा पड़ेगी। मिसाल के तौर पर एक बच्चा जो फोकस ही नहीं कर रहा, मतलब है ना, ये एक टीवी पे कुछ चल रहा है, टीवी पे देखा उसने, फिर इमीडिएट उसका भाई या बहन आ गए, फिर उसकी तरफ फोकस हो गया, फिर आपने पुकारा उसको, फिर जो है थोड़ा दरवाजा खुलने की आवाज आ गई, फिर बाहर से कोई बच्चा पुकारा उसकी तरफ गया। तो ये इस तरह की जो अटेंशन के इश्यूज होते हैं, तो बच्चे वो एकेडमिक्स पे फोकस नहीं कर पाते। तो उन्हें काम डाउन करने के लिए कुछ मेडिसिन दी जाते हैं अगर वो सर्टेन लेवल ऑफ एक्टिविटी अनकंट्रोलेबल है विथ बिहेवियर थेरापी। ठीक है, जब मेडिसिन देते हैं तो फिर थोड़ा काम होते हैं, फिर वो एकेडमिक्स पे फोकस कर पाते हैं, फिर उनके आगे जो लाइफ स्किल्स डेवलप करनी है वो अकॉर्डिंगली आप टीच करते हैं। तो कहने का मतलब ये है कि आप स्टिग्मा फील मत करें कि भाई अरे मेरे बच्चे को फलां फलां लेबल लग गया, वेदर इट इज एडीएचडी, वेदर इट इज ऑटिज्म और एनी अदर कंडीशन। ठीक है ना, ना उसमें बच्चे का कोई दोष है, ना ही हम जो है दूसरों से उसको बचा सकेंगे फ्यूचर में। इसका मतलब ये है कि हम बच्चे को इंडिपेंडेंट रहने के लायक बनाना, ये हमारा काम है। ठीक है ना? दुनिया तो बहुत कुछ कहेगी, ठीक है ना, आपका बच्चा पागल है, आपका बच्चा फला है, पर भाई अल्टीमेटली इट्स आवर चाइल्ड, वी हैव टू टेक केयर ऑफ हिम फॉर हिज फ्यूचर। तो जल्द से जल्द आइडेंटिफाई करने के लिए कहाँ रिसोर्सेस या सर्विसेज अवेलेबल हैं वो आप फाइंड आउट करना है। जहाँ तक रियाद का सवाल है, कुछ क्वेश्चन आ रहे थे कि भाई फैसिलिटीज नहीं है, तो वो स्पेशल एजुकेशन नीड्स के सेशन के बाद हम आपको थोड़ा और फर्दर उसमें डिटेल देंगे। एट द सेम टाइम समी भाई भी एम्बेसी का बात रखे थे, हम उनसे भी कोशिश करेंगे और दूसरे सोशल वर्कर से उनके भी थ्रू कोशिश करेंगे कि भाई किसी न किसी तरह एक दो सेंटर्स एटलीस्ट रियाद में अगर अवेलेबल हों तो बहुत से बच्चों का फ्यूचर जो है वो सेफ हो जाएगा। तीसरी चीज जो है, ये सिर्फ बच्चों का मामला नहीं है। बच्चे जब अनरिकॉग्नाइज आगे जाके बड़े होते हैं, ठीक है, उन्हें जॉब में मुश्किल हो सकती है, गेटिंग वर्किंग इन ए टीम, जैसा कोई एक ऑफिस होता है, वहाँ बहुत से लोग होते हैं, उनके साथ अगर आप ठीक से नहीं रह पाएंगे तो आप जॉब में भी टिक नहीं पाएंगे, तो जॉब में इश्यूज आ जाएंगे। ठीक है, तो या फिर मैरिज का मसला आता है तो वहाँ इश्यूज आते हैं, बात तलाक तक जा सकती है। तो एक बात छोटी जो सिर्फ हाइपर एक्टिविटी और इम्पल्सिविटी की इनअटेंशन की बात जाके अब डाइवर्स में खत्म हो रही है। तो मामला उतना सिंपल नहीं है जितना हम समझते हैं। तो अगर हम इस चीज की अहमियत को समझ जाते हैं तो इंशाल्लाह बहुत से हेल्पिंग हैंड्स आ जाएंगे, तो हमारा काम भी आसान होगा। फिल्जा जी, डिड यू पॉइंट आउट एनी क्वेश्चन टू यू वांट टू आंसर बिफोर वी क्लोज?
Yes, there is a lot of questions. It's not possible कि सर मैं सारे क्वेश्चन का आंसर दूं। सारे क्वेश्चन का क्रक्स यही मुझे समझ में आ रहा है कि पेरेंट्स जो कंसर्न है कि कोई भी एक कंडीशन है उसको कैसे हैंडल करना है, चाहे वो नॉन वर्बल हो या फिर बच्चा इंटरैक्ट नहीं कर रहा है, बात नहीं कर रहा है मेरे से, कम्युनिकेशन प्रॉब्लम है। रीजन कैन बी मेनी, बहुत सारी चीजें हो सकती हैं। आप पहले अपने बच्चे को जानिए कि क्या प्रॉब्लम है। इमीडिएटली डोंट जंप इनटू मेडिसिन, ठीक है। आप थेरेपी से भी बहुत कुछ कर सकते हैं। बहुत सारा प्रॉब्लम तो सिर्फ इससे सॉल्व हो जाएगा अगर बच्चे का स्क्रीन टाइम ही हम कम कर दें। तो ये सारी चीजें हैं कि बच्चे के अंदर हाइपर एक्टिविटी किस वजह से आ रही है। वजह आपकी कुछ भी हो सकती है, ऑटिज्म भी हो सकता है, लर्निंग डिसेबिलिटीज भी हो सकता है, एनवायरमेंटल फैक्टर भी हो सकता है कि आसपास का एनवायरमेंट कैसा है, स्क्रीन एडिक्शन भी हो सकता है, अटेंशन डेफिसिट की वजह हो सकती है। जैसा कि सर ने कहा कि ये यहीं पर रुकता नहीं है, ये अडल्टहुड में जो चैलेंजेस हैं वहां तक लेकर चला जाता है। बाद डिवोर्स और एकेडमिक फेलियर से लेकर के जॉब फेलियर तक भी चला जाता है। और अपने आप को बहुत ही समेट लेना, जिसको कहते हैं सीमित कर लेना, लोग अपने आप को कर लेते हैं और सोचते हैं कि मे बी आई एम नॉट केपेबल, आई एम कर्स्ड। ये सारी चीजें लोग सोचने लगते हैं कि शायद मेरे लिए यही है। तो इसको अगर हम एज अर्ली एज पॉसिबल अगर हम इसको देखें वो बेहतर होगा हमारे लिए। और हाउ टू टैकल रूड किड, ये क्वेश्चन है कि बच्चे अगर रूड हैं तो वो बस हमको वहां पे ऑन द सरफेस टिप ऑफ द आइसबर्ग वो दिख रहा है कि बच्चे रूड हैं, अंडरनीथ द रूड बिहेवियर वो क्या है। वो बहुत सारी चीजें हो सकती हैं रूड बिहेवियर के पीछे, जिसको कहते हैं पावर स्ट्रगल बच्चे के साथ, कि भाई अभी मेरा बच्चा जो है इतना जिद क्यों कर रहा है, रूडली क्यों बात कर रहा है। इम्पल्सिव बच्चे जो होते हैं वो जवाब जल्दी दे देते हैं, मतलब तुरंत में गुस्सा हो जाते हैं और लोगों को लग रहा है कि वो रूड है। वो मैंने जो कहा अल्फ्रेड एडलर की बताई हुई लाइन उसको ध्यान रखिए, एवरी मिसबिहेविंग चाइल्ड इज अ कम्युनिकेटिंग चाइल्ड। उस रूड बिहेवियर में मेरा बच्चा क्या बोलने की कोशिश कर रहा है। अभी रिसेंटली एक 27-year-old बॉय उसको स्पीच प्रॉब्लम है, उसकी मदर मेरे से कनेक्ट की एंड शी वाज कंप्लेनिंग बहुत रूड है, बहुत ही ज्यादा रूड है। अब रूड का क्या आप उसको मतलब समझेंगे, इज ही ट्राइंग टू कम्युनिकेट हिज फीलिंग, एम आई केपेबल कि मैं उसकी फीलिंग को समझूं। मदर भी इस उम्र में क्या वो केपेबल है कि उसके उस फीलिंग को समझे। हाँ, इसको समझने के लिए भी कि भाई वो रूड क्यों हो रहा है, क्या रीजन है उसका रूड, वी नीड टू इंक्रीज आवर कैपेसिटी ऑल्सो। बहुत सारी चीजें हैं हमको भी समझने की जरूरत है। इमीडिएटली एडीएचडी का टैग लगा देना और उसको ये कह देना कि अब यू आर सपोज टू बी इन दिस कॉर्नर। हम सबसे बड़ी गलती जो यहाँ पर कर रहे हैं वो ये कर रहे हैं कि हम अपने बच्चे के लिए एक स्पेस खोज रहे हैं दुनिया में, कि स्कूल्स को भी इसको एक स्पेस देना चाहिए, दुनिया में भी उनके लिए एक स्पेस होना चाहिए। अभी आप जब देखेंगे बाहर जाएंगे तो हम इंक्लूजन की बात कर रहे हैं, सारी चीजों को एक साथ इंक्लूड करने की बात कर रहे हैं। आपके पास जो रिसोर्सेज जो कैपेसिटी है, अगर मैं लीडरशिप की बात करूं यहाँ पर, तो लीडरशिप में यही सीख रहे हैं लोग, हम लोग यही बता रहे हैं। आई एम ऑल्सो अ लीडरशिप कोच इन अ कंपनी विद अमेरिका। तो वहां पर हम यही कह रहे हैं कि वट एवर योर रिसोर्सेज इज एंड वेर एवर यू वॉन्ट टू गो, जहां भी आपको जाना है वो एक अवेयरनेस होना चाहिए, एक कॉन्शियस मूवमेंट होना चाहिए। क्योंकि रास्ते में चलते चलते जब हम निकलते हैं अपनी चीजों की तरफ कि मुझे ये सीखना है, सपोज मुझे अपने बच्चे को इंग्लिश सिखाना है या हिंदी या कन्नड़ सिखाना है या उर्दू सिखाना है, हम निकल रहे हैं चलते चलते, मुझे अगर पता चला कि समथिंग एल्स इज ऑल्सो इम्पोर्टेंट, मैथ्स भी बहुत इंपॉर्टेंट है, हम वो भी उसके तरफ डिस्ट्रैक्ट हो जाते हैं। ठीक है, तो ये सारी चीजें होने लगती है, हम दिमाग में देयर इज अ लॉट ऑफ थिंग गोइंग ऑन कि अभी मैथ्स नहीं सीखेगा तो इतना फेलियर हो जाएगा, कन्नड़ नहीं सीखेगा तो वहां जाने के बाद वहां इंडिया में बदनामी होगी। बहुत सारी चीजों को सोच करके हम अभी यहाँ पे नैरो डाउन कैसे करना है, अपने बच्चे की कैपेसिटी देखनी है और उसको नैरो डाउन करके उसको हैंड होल्डिंग करके आगे लेके जाना है। ठीक है, नॉट ओनली द चाइल्ड, आप अपने बारे में भी सोचो, इफ देयर इज एनी थिंग विथ यू कि आपको कोई प्रॉब्लम हो रहा है या सिम्टम्स ऐसा लग रहा है कि हो सकता है बचपन में आपको कुछ प्रॉब्लम रही हो जो अनएड्रेस्ड रह गई हो, तो आप भी इस चीज को अपने लिए नैरो डाउन करके देखो। स्टार्ट फोकसिंग ऑन वन टास्क अ डे, कि अभी ये आज एक कंप्लीट करना है एंड गिव योरसेल्फ पैट ऑन द बैक फॉर डूइंग दैट, राइट। तो इट्स नॉट पॉसिबल फॉर मी टू आंसर ऑल द
मैं
क्वेश्चन
एक दो
लुकिंग।
क्वेश्चन मैंने देखा है, आई विल जस्ट ट्राई
यस
टू
सर,
pinpoint that.
प्लीज
One
प्लीज।
was regarding the some Ayurvedic medicine.
यस
चूंकि
सर।
हम एलोपैथिक के स्कूल ऑफ थॉट से पढ़े हैं तो आई डोंट वांट टू कमेंट ऑन द आयुर्वेदिक, बट इतना कह सकते हैं कि आप न्यूट्रिशियस फूड पे ध्यान दें rather than giving supplements which we don't know the contents and side effects. तो न्यूट्रिशियस फूड जो आपको खास करके इंटेलिजेंस कॉग्निशन से रिलेटेड है, जैसा ड्राई फ्रूट्स हो गया, ग्रीन लीफी वेजिटेबल्स हो गए, ठीक है ना। तो क्योंकि अगर बॉडी में आयरन कम भी होता है तो भी वो बच्चे की आईक्यू से रिलेटेड है, ठीक है ना। तो जस्ट बिकॉज हम चावल दाल दे के समझ रहे हैं कि हम बच्चों को खाना खिला रहे हैं, बर्गर खिला के या फास्ट फूड खिला के पेट भर रहे हैं, तो इसका मतलब ये नहीं है कि हर एक चीज को हम एडिक्वेटली नरिश कर रहे हैं, जरूरी नहीं है। तो इस वजह से जो न्यूट्रिशियस फूड होनी है वो बच्चों में आदत डालें, और वो बच्चे जो है हमसे सीखते हैं। अगर हम कुछ अनहेल्दी चीज खा रहे हैं और बच्चों को हेल्दी की जोर देते हैं तो शायद बच्चे नहीं सुनेंगे। तो अगर हम डाइनिंग टेबल पे कुछ ऐसी फूड रखें जो हम खा रहे हैं वो न्यूट्रिशियस है, तो बच्चे भी ग्रेजुअली लर्न करेंगे। जरूरी नहीं कि एक दिन में और ओवरनाइट चेंजेस आ जाएंगे, लेकिन अगर हम कंसिस्टेंटली उसको अडॉप्ट करते रहेंगे और बच्चे देख देख के सीखते हैं। तो हेल्दी फूड पे आप थोड़ा ध्यान रखें, नींद का खास ख्याल रखें, उसका एक स्ट्रिक्ट टाइम रखें कि भाई ये टाइम में सोना है, ये टाइम में उठना है। जो स्लीप इरेगुलरिटी आती है, इसकी वजह से भी बच्चों में दिमागी सलाहियत को लेके प्रॉब्लम्स आती हैं। तीसरी चीज जो है वो स्क्रीन टाइम है। अब स्क्रीन टाइम से रिलेटेड और एक क्वेश्चन था कि भाई स्कूल्स जो है वो ऑनलाइन लेसन्स दे रहे हैं, तो हाउ कैन वी अवॉइड। यहाँ पर मैं ये बताना चाहूँगा कि जो एडवांस्ड कंट्रीज हैं, जिन्होंने पहले ऑनलाइन स्कूलिंग को अडॉप्ट किया था, फिर बाद में हमने अडॉप्ट किया था, अब वो कह रहे हैं कि नहीं भाई, वो ऑनलाइन नहीं है, वो फिजिकल बुक्स ही ज्यादा अच्छे हैं। तो जितना हम गैजेट्स कम करेंगे इतना अच्छा, वो कह रहे हैं। तो इसका मतलब है कि अब हमें समझने में थोड़ा टाइम लगेगा। जब वो समझे हैं तो फिर हम की कॉपी करते हैं ना, तो थोड़ा टाइम लगेगा। तो स्कूलों को भी बताने की जरूरत है कि भाई कम से कम कंटेंट जो है वो ऑनलाइन देने की कोशिश करें क्योंकि वो एक पीरियड था, जैसा पैंडेमिक था, कोविड था, कोई और तरीका नहीं था, तो उस वक्त के लिए ठीक है। लेकिन आम दिनों में कम से कम ऑनलाइन असाइनमेंट दिए जाएं तो ज्यादा बेहतर है। ये स्कूलों को भी समझाने की जरूरत है और हमें भी समझने की जरूरत है। एनी मोर क्वेश्चंस? वी आर रनिंग शॉर्ट ऑफ टाइम।
ओके, यहाँ पर जो ऑनलाइन की बात की गई है, देयर इज अ डिफरेंस सर। ये थोड़ा बोलना चाहूंगी कि जो पढ़ाई जा रही है बच्चों को, ठीक है, हम स्क्रीन दे सकते हैं, बट विथ सम बाउंड्रीज, विथ सम लिमिटेशंस। अगर हम वर्क करें तो हम ऐसे एरा में चल रहे हैं कि विदाउट ऑनलाइन हम रह नहीं सकते हैं। खास के स्पेशली टीनेज बच्चों को तो हम दूर रखना हमारे लिए बहुत ही मुश्किल है। बट स्टिल एट द सेम टाइम यहाँ पर पेरेंट्स हैं कुछ ऐसे जो कि वर्क कर रहे हैं इस पर कि बच्चों को बाउंड्रीज कैसे सिखाई जाए। कल वो अपनी लाइफ को वो खुद हैंडल करेंगे, तो उनको बाउंड्रीज कैसे सिखाई जाए, उनकी लाइफ में लाई जाए, सो दैट दे कैन हैंडल देमसेल्फ। इट शुड नॉट बी रीजन कि मेरे बच्चे को स्क्रीन एडिक्शन इसलिए लग गया या फिर कोई भी चीज ऐसे हो गई बिकॉज world is offering a lot of cigarettes in every corner of the street, but am I offering? नहीं, क्यों? क्योंकि हम जानते हैं कि उसका क्या साइड इफेक्ट है और क्या नुकसान है। हम छोटे बच्चों को नहीं, बिकॉज इट इज अवेलेबल, हम दे नहीं देते हैं। उसी तरह से हमको यहाँ पर भी बाउंड्रीज लगाना पड़ेगा। So we have to work accordingly. Why we are unable to create the boundary around it? Because we don't know the consequences of it. It's like for ADHD children या मैं ऑटिस्टिक चिल्ड्रन की बात करूं या न्यूरोटिपिकल बच्चे की बात करूं जो कि अदर डिसऑर्डर्स में नहीं पड़ जा रहे हैं। न्यूरोटिपिकल पीपल आर ऑल्सो फॉलोइंग इनटू डिप्रेशन, एंजाइटी एंड कमिटिंग सुसाइड। न्यूरोटिपिकल पीपल आई एम टॉकिंग अबाउट। क्या रीजन हो सकता है? इट्स लाइक अ स्क्रीन and all these kind of addiction is working as a slow fryer, brain fryer, which is hampering their development. Later on the self esteem पे बात आती है and they are unable to handle things and they take random steps in their life. So we must work on boundaries. कैसे boundaries पे work हम कर सकते हैं? Well, I'm really grateful for this opportunity IIPA की तरफ से, और डॉक्टर शफीक ने मुझे कांटेक्ट किया। I'm really grateful for all of you being here. यहाँ पे मैं अपने प्रोग्राम के बारे में बात करना चाहती हूँ। मैंने 7 स्टेप ऑफ ADHD पेरेंटिंग प्रोग्राम डिजाइन किया है। If you all are interested, you all can take the program. I'm just giving link to Dr. Shafiq. If he is willing, he can put the link into this chat if he
हम
want.
क्या कर सकते हैं कि जो फीडबैक फॉर्म दिया गया है उसमें दोज वर इंटरेस्टेड इन लर्निंग मोर अबाउट दिस, वो अपने कंसर्न्स भी डाल सकते हैं और कॉन्टेक्ट डिटेल्स डाल सकते हैं, ताकि हम उसका एक सेपरेट ग्रुप बनाएं जो फोकस ग्रुप रहेगा सिर्फ इससे रिलेटेड। तो फिर वहाँ जो भी क्वेश्चंस हैं, जैसा कुछ लोग पूछ रहे हैं कि भाई वो क्वेश्चनर चाहिए और इस तरह के लिंक्स वगैरह जो ना, तो वो फोकस ग्रुप में हम डाला जा सकते हैं ताकि दूसरे लोगों को डिस्टर्ब ना हो।
यस सर, ओके ओके सर। तो ये अगर आप लोग इस तरह से इस पे वर्क करेंगे अपने बच्चों के ऊपर और उसके कंडीशन के ऊपर, डेफिनेटली आई एम श्योर आप अपने बच्चों को इस कंडीशन से बाहर निकाल सकते हैं। ये भी कम बड़ी बात नहीं है कि आप यहाँ पर जो बैठे हैं, पिछले 1 घंटे से ज्यादा से बैठे हैं, अपने बच्चों के लिए बैठे हैं, एंड दिस इज अ वेरी बिग थिंग। दिस इज अ वेरी बिग थिंग। गिव योर सेल्फ ग्रेस कि आप यहाँ पर अपने बच्चों के लिए हैं, एंड दिस इज what you are creating change in the in this in this world, not only by helping your child but also helping in many generations. आप इस तरह से help कर रहे हैं. So very thank you for being here with me. So we are
thank you, Filza ji.
We are really grateful
so
for this session.
Yeah. Thank you so much. And
thank you, sir. Thank you
I
so
thank
much.
all the participants who have been listening to us patiently for more than 1 hour. And the number had gone up to 89, which is a good number, I guess. So I hope at least those number of people have benefited from the session. And if there are any healthy suggestions, healthy criticism, you can share in the feedback form so that we can improvise our sessions further. And we bring you many more topics to come in this. Jazakallah khair. Thank you so much. I hope.
Dr. Shafi.
Yeah, please.
Yeah, Assalamu alaikum.
Assalam.
Yeah, thanks for this session. It is very informative. But how can we contact you?
Me?
Yeah.
Okay. Personally, I think the group from where you got the notification, you'll definitely get it from there. Sorry?
No, just randomly I got this link from the WhatsApp.
Acha. Okay. I will send you a direct message after the session.
Okay. Do you have any center in Riyadh?
We are trying to bring with the help of so many, the stakeholders. Unfortunately, people are not realizing its importance. So it's not a personal interest initiative. It's just a community need. So if people are interested, we can join hands and come up with something, which is lacking in the area. So what happens is usually the schools are running without any effort, in the sense admissions are full, okay, teachers are taken care of, and fees is given. So they don't care about the other problems because the school is running. I'm sorry if I'm hurting someone, but this is our observation by surveying so many schools. So the response had been very not very encouraging. So that's why we want some helping hands to come up with something like, because here setting up anything needs a lot of resources. Not only the cost, it's the expertise and the motivation and the awareness among the people, I mean the general public. So this awareness itself is a challenge for us.
Yes. Dr. Shafiq, I have experience in this field from last 3 years because my child also suffering the ADHD. Okay. Then I have been consulting to so major doctors in India and in Saudi Arabia as well. And we have been gone through so many sessions and so many therapy sessions from last 3 years. But, still my son haven't developed a single thing, like even is not able to respond the basic thing. Which is very hurting to me, because after spending the lot of money and a lot of sessions, a lot of efforts, but still he couldn't able to respond to the single name. To
for the sake of the time, I just want to ask you some quick questions. Was his hearing tested?
Yeah. Everything, we have gone through everything, all the tests and everything.
Hearing was normal?
Yes, everything is normal.
Okay. Is he interested in any other activity of his choice?
Not at all. And he's not able. Yeah.
He's not responding. There is any eye contact with someone? I mean, he's interacting with
eye contact is okay. Yeah. He developed eye contact. Initially, it was not there. Okay. But now he's developed eye contact and setting tolerance also there. But he's not responding to his name even. Okay.
Pregnancy and delivery and immediately after delivery, everything was fine?
Yeah. Everything is all normal. And the thing is that, till his 2 years of age, his normal height is speaking about 40 words. Suddenly got stopped his speaking.
Okay. So now, was there any fit or conversion in his lifetime? I mean, early childhood and later?
No.
Okay. So you said he stopped talking at age of 2 years.
Yes.
Okay. Was there any delay in acquiring the speech initially, or he acquired normally, but it stopped at 2 years?
Yes. He acquired normally, and he was, at the age he was very normal, and he's a very smart child as of us. But after 2 years, the COVID also be, at the time, then we couldn't able to understand what happened to him.
So whatever the speech skills he had acquired over a period of 2 years, so after 2 years, it didn't progress, or it stayed stagnant, or is deteriorating?
Yeah, it is deteriorated. And now at this is 6 years of age, he not able to speak and not able to call his mom or the father. not a single word, you can say.
Okay, got some idea about this. I will share the number. We can talk at length because I don't want to prolong the session. Yes.
Okay.
Thank you for sharing your concern. And definitely, it's a matter of many parents. We can talk. I'll share the session after I'll share the number after this. Thank you.
Okay, doctor. Thank you
Any
for
more
it.
question before we close? Quickly unmute yourself and speak. Otherwise, we are closing. Thank you again for joining our sessions. And if you are connected to the WhatsApp group, you will get the notifications for future sessions to come. And in the feedback session also, you can give us, some suggestions and ideas. You want to bring some, new ideas in our quality of sessions we do. Thank you so much. Jazakallah khair. Thank you, Filza.
I want to thank
Thank you so much.
Madam. Thanks a lot,
Thank you,
ma'am. Being I'm 31 years here in Saudi Arabia, I learned a lot of things from your session. I'm father of
Thank you,
5 kids, and also like I got a lot of information. I got a lot of I have different age of mashallah. Thanks a lot. Allah
Thank you so much.
give you whatever you wish you, inshallah we'll pray for you. And we got a lot of knowledge. We got a lot of tips, a lot of things. Thanks a lot. Thanks a lot.
समीर भाई खाली बोलने से नहीं होगा, एक चाय पिलाना है, आ रहा हूँ, ठीक है? Thank you.
Come. Chai with snacks. Don't. I give always 1+1.